Hello, hello. This chapter touches a lot of bases, some of which I care a fair amount about, and I've recorded a separate little lecture on that. This area, this field, is still undergoing changes in terms of federal regulations. And I personally would like to see more regulations because more people are getting their medical quote knowledge end quote from the internet, and it just kills me to see people on Facebook say, "I've got this problem. Does anybody know what to take?" And then some random person tells them what to take. The We need to be protected, and the FDA should do it, and it's doing it, but it could be doing more. And a lot of the early part of the chapter deals with St. John's wort. Uh, and I provided a picture of the plant and a supplement bottle. Nature's Prozac. It may work actually in a similar way to Prozac by blocking reuptake. But let me say something about Prozac and St. John's wort. Half-life. The half-life of St. John's wort is very short. And it used to be, and it probably still is, that you have to take it 3 times a day. And if you're not disciplined enough to take it on that schedule, your brain comes out from under the influence of it, possible, multiple times a week. Prozac has a huge half-life, and one missed pill, and you take the next one, and your brain stays under the influence of it. And it's clear that these drugs don't work magically, instantly. They don't relieve pain like morphine does. Uh, you have to wait, often weeks before they work. And part of that therapeutic process is being consistent. Let me say something else. I had a former student decades ago who was dealing with anxiety and depression, and was trying to take St. John's wort to treat that. And there were data from Europe indicating it could help. And I read that literature, and there was a certain dosage that they used and a time pattern. But the dosage was not for grabbing a weed and chewing on it. It was for consuming extract of St. John's wort. Now, extracts are concentrated. I remember my brother played a trick on me at, well, he didn't know it was a trick, but I liked hot food. And he brought a spicy sauce to Thanksgiving dinner and asked me if I wanted to try it. And I looked at it and at the label, and I think capsaicin or chilies actually were maybe the third ingredient. And I said, well, this can't be bad. Third ingredient. And I started eating it, and I neared to die. I almost stopped breathing. And it turned out the ingredient was not chili pepper, it was chili pepper extract, which means concentrated. Now, I gave you a link for a picture of St. John's wort and a supplement bottle. And if you look at that supplement bottle, it says 300 milligrams of standardized extract. extract, extract, extract. So when my student was desperate and, really needed an intervention, she went to the local GNC and they were selling St. John's wort 300 milligram capsules, looked good, but it wasn't extract. They just dried out the plant and jammed it in a capsule. And boy, that was not the same. They gave you exactly the same milligrams, but it was not what the research in Europe had been based on. I have not forgiven GNC too much. I mean, people who are dealing with depression, their lives can be at risk. So there's a discussion of, the FDA and drugs and legislation. And this is something that the forces of darkness, a big supplement, don't want to be regulated. They want to be left alone so they can pretty much do what they want. And there are senators on both sides of the issue, like Democrats and Republicans, that help big supplement. And this book is, 300 milligram tablet of St. John's wort contains some amount of the plant, but it's really an extract that the research is based on. Oh geez, I didn't have to give you a picture. That one doesn't say extract. Positive mood. I worry that, desperate people are getting their medical information from random people on the internet and taking these things, and we really should protect them. And this is huge business, big, big, big business. And, normal people need to be protected. And ephedrine, that was bad. Adulteration is one thing, but false or borderline false claims is something else. Red yeast rice, 2007, cholesterol, that was bad. I trust Consumer Reports a lot. So here's a table from Consumer Reports with ingredients, claim benefits, and risks. And caffeine powder, oh boy. You may remember the story I told you about the college student who bought caffeine powder and treated it as if it was, no-dose pills, ignoring the fact that no-dose pills are not straight caffeine, and he died. Chaparral, Coltsfoot, Comfy. There's green tea extract powder, kava. If you want to read things on the internet, access Consumer Reports. Himbine, that's popular. Increased blood pressure, rapid heart rate, headaches, seizures, liver and kidney, panic attacks, possibly death. These things are not to be taken lightly. There's more on St. John's wort. And, one systematic review, that's a meta-analysis. It probably does something. SAMe discussion there, males, they'll buy anything if it's labeled natural male enhancement. And there's a plethora of drugs that are offered there, and there's ginkgo. Uh, on campus, there was a ginkgo biloba tree. It's very strange leaves, as you can see, um, and there's some indication it might help Alzheimer's patients, but again, I'd wait until more data are available. People just pop this stuff like it's nothing, and weight control and ephedrine again, and I don't know. Oh, that's all there is on this page. So Herbalife has made a gajillion dollars on this stuff, 3.5 billion in national sales in 2011. This is big business, and these businesses can afford lobbyists. Over-the-counter drugs, the extra little lecture I gave you on Tylenol, over-the-counter is there. I was surprised to find that students didn't know what this term meant, but it means you don't have to get a prescription. You don't have to, go to the pharmacist and ask for it. It's just right out there on the shelf, and there's FDA and regulation, safety and efficacy. Look at all that stuff. Oh no, some of that shampoo, actually. Um, but generally recognized as safe, generally recognized as effective. Safe, you got to have safe. Effective would be nice. Generally recognized as honestly labeled. Yeah, that'd be nice. Why is that not the law? So the book mentions that there's a gajillion products, but those products don't contain that many ingredients. So the focus on regulation has been on the ingredients and simplifying labels so people can understand them. There's a good plan, and more discussion of over-the-counter versus prescription. I wouldn't have thought that this discussion was necessary, but I am wrong. People do need to know about these distinctions. And things move in both directions, over the counter and back. And the Breaking Bad precursor to methamphetamines. There's a show I had to stop watching. Middle-aged men making bad decisions bothered me too much. Stimulants, and of course, we've already dealt with caffeine. Caffeine tablets, weight control, PPA. You'll find that sometimes. I think that's still true. These drugs work for about as long as you take them. And there's ephedrine again. The market for weight control products has shifted largely from over-the-counter to less regulated dietary supplements. People need to be protected. Sleeping aids, oh boy, I know people who take these constantly. And antihistamines and other drugs, and Sleepies, Sominex, Nitol. I'm not saying they're bad, but I worry. That's if you've seen my supplemental video on Tylenol, I worry. And antihistamines can make you drowsy. Yeah, not immediately, but about 20 minutes later, uh, I would steer clear of almost all of these. And here's analgesics, which is what my supplemental talk was about. And they use the term opioids, which I reserve for what's natural in your body. I would use the term opiates. And analgesic means without pain. Anesthetic means without sensation. You can get some local anesthetics for tooth pain that can work pretty well. Pain is complex, and I went over that a bit. Visceral and somatic. Opiates can be quite effective. Aspirin is a really good drug. Um, religion got mixed up in this earlier, but it's really good, and the formulation that we now use is much less likely to produce GI problems. Acetylsalicylic salicylic acid, and used it on his father. Uh, it it's it's within limits a beautiful drug, and there's discussion of Rye syndrome in here, which is why we don't give it to children anymore, which unfortunately is, I think it's why we give a lot of Tylenol to children. Endocannabinoids are involved in the development of the nervous system, and they should not be given lightly to children or pregnant people. Tylenol and liver. I've had a few surgical interventions, and I don't usually take Tylenol, but it works. And I'm a fan of endocannabinoids, which you'll discover in my supplemental lecture. I loved House, the television show House. He was a brilliant diagnostician, but he was popping opiates that were mixed with acetaminophen, Tylenol, like candy, and drinking tons of scotch. Boy, is that a bad idea. I don't mind taking Tylenol as an adult, but pregnant women and children, ibuprofen seems to work really well. We worry about Rye syndrome with aspirin, so maybe not go there, but the research that's in my supplemental talk seemed to indicate that ibuprofen was pretty okay. And, Bayer and made in the United States, it can reduce fever and anti-inflammatory. Let me say this about that. Fever is your friend within limits. Fever is a defense mechanism of the body to protect you against bacteria and viruses. And there are suggestions. Remember when people used to get the flu before we wore masks and socially distanced? People died of the flu every year. And there's reason to believe that more people died of the flu because they took aspirin and lowered fevers. And because they lowered fevers, the flu lasted longer and became more threatening. So if you can tolerate the fever, roll with it. I think the book points out that maybe up to 103. And then there's doses, and it's neat. Fever reducing effective aspirin does not work on your normal temperature, only if you're overly hot. I used to take tons of aspirin. I guess I should have had some GI bleeding. Nothing was obvious to me. I'm currently taking a blood thinner, so I can't take aspirin, but I would like to. There's Rye syndrome, and evidence that aspirin was causing increases in Rye syndrome. And there's prostaglandins in COX-1 and COX-2. That was in the video in my supplemental lecture that I said not to look at. And acetaminophen, there we go. As an adult, I'm not worried about taking it at all, unless I'm drinking. And if you're drinking, I would worry about acetaminophen. And hidden ingredients, ibuprofen. For some reason, I don't take that, but I think it's a very safe drug. And there's COX again, and non-steroidal anti-inflammatories, Vioxx. I think I almost took that a while ago. And then there's a table of what's in things. Naproxen, I had some issues years ago. Naproxen helped quite a bit, actually. I don't know much about the long-term safety of that one. Cold and flu. A student long ago was getting cold and flu symptoms right before final exams, and her physician was going out of town, and he gave her prescription strength drugs that rendered her stupid for the finals. He gave her scopolamine. She got destroyed. And if you're going to blow your nose, blow your nose. But don't start taking drugs you're not familiar with right before important exams. Don't do it. Now, if a physician tells you to do it, do it. But if you just, you're on the internet reading things on Facebook, please, that's not where to get your medical information. So we're talking about viruses and washing your hands and treatments. And here's what's in a bunch of things. And cough suppressants. Lozenges with honey are really good. People are too quick to take these drugs. And giving them to children, I worry about quite a bit. Allergy and sinus, if you're under the care of a physician, don't worry about it. But if you're winging it, don't. And there's dextromethorphan, and people take this as a recreational drug. Really bad idea. Really bad idea. How to pick one? So there's things you can get. Again, there's so many products, we can't review them all, but what's in the products we can worry about. Why treat symptoms you don't have? Good question. Why take a spectrum of drugs because you have the sniffles? Focus, focus, focus. So here's our summary, and this is a pretty straightforward chapter. It's important should not be underrated. This is important stuff. And US citizens need to be protected. And I don't think they're being protected enough. There are lobbyists for these multi-billion-dollar supplement companies that are, making it an issue of individual freedoms, and let people decide what to take. Oh yeah, why don't you do your own abdominal surgery? See how that works out. Um, and there's some summary questions. So, an important chapter. And my little contribution on Tylenol, I think it's important. I think it's, very safe for adults unless you're drinking alcohol. But I really do worry about pregnant women and young children. See you next time.